Welcome back to Rohrich Knows, helping you become a more educated you. Let's talk about the power of no. I think no is the hardest thing to say, but it's probably the most rewarding thing to do in medicine and in life. And certainly as a plastic surgeon, I have found that to be very, very powerful and useful in my practice. Because in plastic surgery, you know, if you learn to say no, you can prevent devastating things that happened to Michael Jackson. Because it's not just, you know, Michael Jackson, but it's the surgeon and the surgeries he's had that really kind of destroyed his face and his nose. It's a tragic event in life. So the power of no is so important, because you shouldn't do things that are crazy or things that don't look good. Because if you're doing things that look weird or different, don't do it. I mean, like the Ken doll guy, I mean, I don't know how many surgeries he's had, and you know, you just need to learn to say no, because don't do crazy stuff. And you know, I think that's the most important thing we have to learn. You know, because we're plastic surgeons, we're physicians first, so we do no harm. And remember, we're in the face protection, not witness protection program in plastic surgery, so that we can avoid changing good-looking people into somebody that's not so good-looking, or somebody that may not look very, very humanoid at all. And these things are really important, because the surgeon has to say, no, no way, I'm not doing that. I'm not going to change you to a cat or somebody else. And to undergo, you know, 6 facelifts, you know, at age 46 is totally ridiculous. I mean, this is the kind of stuff that, you know, I blame the surgeon as much as anybody else. I mean, you know, 6 facelifts? I mean, give me a break. I mean, that's crazy. And then, you know, taking somebody who's beautiful, and then obviously, you know, you should enjoy her beauty and refine it with finesse procedures rather than changing who and what they are. And that's really a catastrophic event, you know, to change somebody into someone that really doesn't look good. So what are some steps to prevent or to correct overdone or botched surgery? Choose the right path. Here's 5 steps to do that. The most important thing is the 3 E's: experience, expertise, and exceptional results. You're gonna master plastic surgery. That's how you find a true expert. So you find a board-certified plastic surgeon or a facial plastic surgeon that specializes in revision surgery, revision rhinoplasty, revision facelift surgery. These are completely different operations than primary rhinoplasty or facelift surgeons. And then go see and get a comprehensive evaluation and to understand the degree of the surgery and develop a clear plan for revision. You know, it may take a year or 2, because with a rhinoplasty, if you want to have a revision, it'll take a year or 2 before you can do it. And then set realistic expectations. I always take my revision patients and I set them down and I say, these are the things we can do and these are the things we can't do. You can't go back to where you were before. We can't totally fix it. We can't make the nose completely straight. We can't get rid of all the scar. So be realistic, really important. And make sure if they're smoking, don't operate on them. And then you got to wait a proper time before you do the revision, you know, because you got to allow for wound healing. You know, I saw a patient recently that had 4 rhinoplasties in a year and a half. I mean, that's crazy. So I'm going to have him wait about a year and a half or 2, and before I do anything, and maybe inject fat into his skin of his nose because he's so damaged. So wait is the time. Allow for normal wound healing. And then focus exactly on what you want to fix. You know, the form, the symmetry, the function, all these things you must list, the 3 things that you can do and the 3 or 4 things you can't do. These are very important. You got to know your limitations, and it's never going to be perfect. It'll be straighter, better, but it'll never be perfect. So you can take somebody like Demi Moore that has had the gamut of surgery and had some mishaps and actually really had cross-cheek depressions, and then now she's been corrected, and she looks really dramatically better because she's had good surgery and she's had rejuvenation surgery, and I know she's had facial fat surgery and removal of the scar and fat restoration in that area. And I think that's really important. So then and now. The key is look natural. Don't look weird. And here's a patient that I saw that had 2 previous facelifts. And of course, she had a significant facelift deformity, and we released, resected, refilled, reshaped, and restored her face, gave her her shape and contour back, and just made her look normal and more youthful. And I think that's really what you want. And I think, you know, that's the takeaway. You know, you can make them look more youthful and more normal. That's good. Now, what are the 5 must-do tips to prevent all this stuff, to prevent all these things? Do things that are subtle, okay? So again, it starts with the 3 E's: experience, expertise, and exceptional results, if you want to find a true expert. So choose a board-certified plastic surgeon. Now, that just gets you in the ballpark. Then you got to find out, are they an expert in body contouring, and facelifts, and rhinoplasty, and breast augmentation? That's where you should be guided. Find out an expert. Just because you're board certified doesn't mean that you're going to be your surgeon. And then you got to go interview them. You got to go talk to them. And you got to see their results and see if they're open and honest about what they can do and what they can't do. So you got to be able to communicate with them. I only operate on people that are realistic, that I like, and that don't smoke. And then you've got to prioritize these changes that you're going to do. Less is often more. And as you age, the small increments are much better than doing a lot of big things, especially if you're starting at your 30s or 40s. Don't do crazy stuff. And then the key is focus on harmonious balance, giving you enhancements that look natural and prioritize symmetry and proportionality that give you a good outcome. And then by all means, don't do trendy things like the fox lift or the ponytail or any type of acronym lift. You know, that's crazy. You know, don't do things that make you look weird or like somebody else. That's not good. And don't be the first to try something and the last to give it up. So focus on techniques and technology that gives you classic, beautiful enhancements that are safe and that have proven outcomes. That is so important. And here's examples of patients with facial aging, you know, and we did central facial fat augmentation with a deep layer facelift. You can give her shaping and contouring. You can give a beautiful shape and contour. It looks natural. It looks youthful. And that's really what you want. You want a youthful, natural-looking patient. Another patient who's in her late 40s, she just wanted to look youthful. She had a square face, and we just shaped and contoured her shape of her neck and beautified her shape of her neck. And another patient, same type of thing, facelift, eyelid surgery, chemical peel, just gave her a nice looking shape and contour. Rhinoplasty, same thing. You want to correct the things that are bothering her. The bulbous tip, the dorsal hump, the shaping of her nose, bringing her tip up, just giving her a natural looking nose. That's really what's important. Another patient, really thick skin, bulbous tip, dorsal hump. You want to shape and contour the nose. You want to give her a natural looking result. All these patients have significant issues, dorsal hump, deviation, airway problems, and you want to then do things that give them a natural looking face and nose that makes their nose match with their face. So the key is be smart, be safe, know before you go, do your homework. Remember, you only have one face, one nose. It's not like buying a pair of shoes. You can't take it back. You can't take your nose back or your face back. So know before you go. So give me your thoughts, give me your comments, and until next time, stay safe, stay informed.